A new report shows New York is one of only 3 states that is on track to contain the COVID-19 pandemic. COVID Act Now also puts New Jersey and Massachusetts at the head of the class. But we're not out of the woods just yet. And as Jeff Rusak reports, the pandemic is still hitting minority groups in Western New York harder than others.
The COVID-19 numbers from the Jericho Road Community Health Center are alarming. Their offices typically see people from Buffalo's west and east side, including immigrants and refugees. Their testing numbers from COVID-19 are much higher than the rest of Erie County. Less than 6% of tests across the county come back positive. At Jericho Road, it's almost 16%. Even in the last week, 10% of their tests were positive. Doctors at Jericho Road say if you're white, you have a 4% chance of testing positive at their facility. If you're black, that number jumps to 15%. If you're from Burma, it's 35%. Dr. Myron Glick says the Burmese and Nepali community tend to have essential jobs and close-knit families.
And then they're bringing that infection home to their multi-generational household.
He attributes the elevated numbers in black people to something else.
400 years of racism and discrimination. African-American folks in general came into COVID with higher rates of diabetes and hypertension.
Pastor Kinsner Pointer is a part of the African American Health Equity Task Force. They're working to spread information about COVID-19 throughout Buffalo's black community.
To put testing in the neighborhood where people live.
Both Pointer and Glick say just because numbers are lowering in New York doesn't mean COVID-19 is gone.
We know what works. Why aren't we simply doing what works?
Getting this word out there by allowing people to see what's really happening, that there will be widespread support across our community to take care of our neighbors.
Jeff Rusak, 7 Eyewitness News.